Thank you, Mr. Chairman, and I want to follow up on that. We do appreciate all of you and appreciate your hard work. We've got 3 excellent doctors here, and you got a bunch of committee members that have been around for a while, and we've seen rollouts in the past in the VA, and they've been kind of rough. In fact, we've seen rollouts in government, period, in all kinds of different things, and they've been pretty rough also. The problem is that the committees become the backstop, you know, in regard to pushing things along and providing the resources, you know, if we do have a problem. So in Arkansas, there's a lot of excitement about the Mission Act. I've talked to countless veterans and VSOs, private sector healthcare providers around Arkansas. So there's a lot of looking forward to it. To be honest, they don't have much information yet. And so I guess a question would be, with the implementation only 9 weeks away, what's the plan for engaging providers who are currently providing community care? Again, they don't understand what's going on. What's been communicated to them about the changes, and should they expect to see, what should they expect to see in the timeline?
Thank you for that question, Senator. Any change at this scale in a system our size must be taken seriously, and at the core of our approach to the Mission Act is, of course, veteran centricity, but also the thought about our providers and our employees undertaking this change. We want to make sure that they not only have the tools in their hand that they need to implement this, but that they have the knowledge and the awareness of the why we're doing this, that this is a new era of veteran empowerment, that they are able to sit down with a veteran one-to-one, as we do as physicians, and say to that veteran, I am able to help you make a choice that's in your best medical interest. We've started communicating on that front. We've given the field a toolkit to use, and we've launched training as well on the key tools that are new to them, specifically the decision support tool. So in just this past month and accelerating over the next couple of months through and beyond June 6th, Senator, we will continue that campaign.
Okay. How about outreach to veterans? What are we outreaching? Do they know what to expect on June the 6th? Or are we doing anything proactive in that regard to the veteran community?
Absolutely, Senator. And actually, Section 121 of the Mission Act directs us to do exactly that. We have developed a robust plan to reach veterans across all eras and in various modalities as different eras may need. So not just through print materials, not just a poster in a facility, but also online and in other spaces that they may need information about VA and about the new benefits and care and services that they can receive under the Mission Act. We are also engaging and very much appreciate our Veterans Service Organization partners, as they have offered to have several of their delegates trained such that that message and education can be amplified for the veterans that they encounter.